Why do people get later abortions? There are several reasons why people have later abortions, and they generally fall into two categories. It's either due to some new information that has come about during their pregnancy or a result of barriers that exist to getting abortion, Dr. Villavicencio says. The new information category includes learning something about the health of the fetus or the pregnant person, but it also encompasses people not realizing they're pregnant until later on. This can happen because they're using birth control, they have irregular periods, or they're young and not aware of pregnancy symptoms, Dr. Grossman says. Dr. Villavicencio says she's had abortion patients who are grandmothers and did think they could get pregnant. Late recognition of pregnancy is not unusual, and certainly not a fault of someone for not knowing. Unless you're taking a pregnancy test every single month, which no one does, it's very easy to miss a pregnancy, she says. Fetal health problems could include a malformation of the fetus or genetic abnormality that means the fetus won't survive. But these problems often aren't diagnosed until later in the second trimester or into the third because the screening tests and scans don't pick these problems up until that late, Dr. Grossman says. The special ultrasound, that's colloquially known as an anatomy scan, where the fetus is large enough that doctors can see the heart, brain, and spine, isn't usually done until 18 or 20 weeks. But can be as late as 23 weeks based on the availability, where a person lives, or even what's going on in their life, Dr. Villavicencio says. Then if the scan does pick up something concerning, people need time to get a specialist appointment for a second opinion. Similarly, people can develop dangerous health complications in pregnancy that may not emerge until the later second trimester or early third trimester. Two examples are preeclampsia, or high blood pressure later in pregnancy that can become life-threatening, and placenta previa, when the placenta is covering the opening of the uterus and can cause severe bleeding during pregnancy. The treatment for these conditions is delivery and C-section, respectively, Dr. Grossman says, but if the patient is still in their second trimester and the fetus isn't viable, abortion is sometimes the best option for their health. Barriers to accessing care can also push people who want abortions to get them later in pregnancy. These obstacles include living far away from an abortion clinic thanks to anti-abortion clinic shutdown laws, facing a medically unnecessary state-mandated waiting period of 24 to 72 hours that requires multiple trips to a clinic, and the costs associated with that travel such as gas, hotel stays, childcare. 60% of people seeing abortions already have kids and unpaid time off from work. Plus, if you're having an abortion procedure rather than getting the abortion pill to take it home, you might need someone to travel with you, Dr. Villavicencio says. Another is the cost of the procedure itself, an average of just over $500 at 10 weeks in 2014, which may not be covered by health insurance, especially for people living on low incomes who have Medicaid. Thanks to the 1976 Hyde Amendment, the federally funded Medicaid program can only cover abortions in the cases of rape, incest, or threat to the mother's life. States can use their own funding to cover the procedure, but only 16 do so, while 34 states and Washington, D.C. stick to the federal standard. According to the Kaiser Family Foundation, because of structural racism, Black and Latinx women are more likely to have Medicaid insurance and are thereby less likely to have the procedure covered. The price of the procedure is, of course, added to any travel costs mentioned above. That is a real barrier for many patients, Dr. Grossman says. The Hyde Amendment is a common reason why people end up presenting for care in the second trimester, because it took time for them to get the funding together to be able to pay for the abortion. And the later an abortion is, the more expensive it is, so the problem snowballs. By contrast, in a 2012 study in the American Journal of Public Health Drive, Grossman found that in the 2 years after Iowa made early medication abortions easier to access through a telemedicine program, that people were almost 50% more likely to have a first trimester abortion, while second trimester abortions declined, even after controlling for other factors. I think there's a lot of evidence showing that these restrictions can push people later in pregnancy and increase the likelihood that they'll get a second trimester abortion, and conversely, that efforts to expand access to early abortion can help to reduce second trimester abortion, Dr. Grossman says.